Here with more is Dr. Rob Davidson, an ER doctor in Western Michigan and the executive director of the Committee to Protect Medicare. Dr. Davidson, great to have you on. How concerned should we be about the Delta variant?
Listen, if you're not vaccinated as an individual, you should be extremely concerned. And as a physician who works in an area that only has about a 42% vaccination rate, and we really don't see it getting much above 50%, I'm highly concerned about the patients I take care of, about the system that I work in. So yeah, I think if you're vaccinated, studies are now showing 90% protection against any symptomatic disease, even from the Delta variant. But this variant is highly transmissible, maybe more deadly. And even having had COVID in the past shows pretty minimal protection.
What are you seeing in the ER right now in terms of cases? And the one thing that I heard that was a headline that really struck out at me, it said there's one thing that everybody in the hospital with COVID has in common. They have not been vaccinated.
Yeah, we don't have a lot right now, right? But the ones we do are people who aren't vaccinated. And actually, the patients I'm seeing more of are the people with long COVID symptoms. I see people with chronic headaches, people who still are having a hard time breathing, 2 months after they've, quote, recovered. But, and their tests are negative and their oxygen's okay, but they can't walk a flight of stairs. They can't walk out to the mailbox. This is pretty common, unfortunately. People getting blood clots, 4, 5, 6 weeks after having COVID and, having a so-called recovery. And so, yeah, vaccination is our protection. That's how we get through it.
What do parents need to know about the Delta variant? Because it feels like we've had this sort of one mind frame where it's once you're vaccinated, we'll get to some sort of, even if it's not herd immunity, the kids are going to be generally more protected. But is this Delta variant causing more severe illness in children?
Well, I don't think we have data on that per se, but again, it's more transmissible and possibly more deadly. So if it's 60% more transmissible, and if kids under 12 can't get vaccinated right now, I don't have kids under 12. My youngest is 14. She's fully vaccinated now, thankfully. If I had a kid who was 11 years old, I would have them wearing a mask if they were going to be indoors, because I don't trust that people are following the guidelines. The guidelines say if you're fully vaccinated, you don't need a mask indoors. If you're not, you should. I think most of us understand that people who aren't vaccinated are going without masks. And so, yeah, I would say protect your kids. Go to your school board and push them to still require masks for unvaccinated kids, and frankly, to require documentation of that. Maybe they can't require vaccination, but at least require the documentation. They do it all the time for every other vaccine, for kids to go to school.
Are you concerned at all about the summer travel season in terms of both domestic travel and also international travel?
Well, we know that the Delta variant in particular is the dominant strain in many countries, right? We know in the UK it's now 90% of the cases. I think in Lisbon, Portugal, it's something like that. And it's very likely to spread across the European continent if that's the numbers we're seeing in those places. And so, yeah, people should be cautious. Again, if you're fully vaccinated and, the countries to which you're traveling allow you to enter, you should feel protected because, frankly, the vaccines do protect you. If you are not, I personally wouldn't be traveling. I wouldn't be going into airports or airplanes. But if I were, I would be wearing at least one mask, probably two, and really being cautious about not contracting this variant.
I don't know if you've spoken to any of the patients, who you're seeing, but are they giving a reason as to why they're still vaccine hesitant?
Yeah, a few of them say just plain, no, I'm all set, I'm all set. I've pressed quite a bit, actually, when I have time, on sort of quieter times in the ER. And many of them, one guy said, well, my wife said we're not doing that because of the things she's reading on Facebook, frankly. I've had a few people tell me, well, I don't believe that COVID is real, so I don't think that I need to get a vaccine. And so that's the concern, right? They've been programmed for 16 months that it is not a big deal, which it is. And then they're getting information from sources like Facebook, from a cousin, or frankly, from, some people calling themselves doctors or experts who are spreading disinformation, and from members of the Republican Party who are refusing to get vaccinated and who are continuing to spread the disinformation. That's what I'm hearing, and it's tough. We got to fight it. And I just keep telling them the truth. I don't get in arguments. I don't get in shouting matches. I just keep telling them what I know to be true. And hopefully, and I have had a few, where you break through and they say, I believe you. and then they get the vaccine.
Given that the vaccination rate in certain parts of the country, like where you are, for example, and others even lower, given that that's the state of affairs right now, and also that we're seeing some of these new, more contagious variants, what do you think that the fall looks like?
Well, I think the fall and winter are going to be a real dicey, unfortunately, in these areas. We saw with the first wave of COVID, in areas like mine, we didn't get a massive wave right up front. Other parts of Michigan did, the Detroit area did, because they're very populated. Rural areas, it's going to take a little longer for it to penetrate. But once it does, we saw it in December, January, just massive spikes, hospitals full for an hour and a half in any direction, and patients, waiting in ERs for hours and sometimes days to get a bed because the beds were all full. We're going to see that eventually. And again, it's probably not going to pop up as big national numbers all at once. But in communities, you're already seeing it in parts of Missouri, I believe, parts of Arkansas, places where the vaccine is not prevalent. You're going to see these popping up here and there. So please pay attention if you're in those areas to your doctor, to your local health department, frankly, to your local news, because that's where you're going to get that information. Hopefully Cheddar wants to talk about that, and I'm glad we are now. And I'm hoping that others do as well, because big metro areas largely are getting pretty well vaccinated. Areas on the coasts are getting pretty well vaccinated. Probably won't be seeing those massive spikes. We're going to see them where I am in rural West Michigan, unfortunately.
And just lastly, in terms of just the practicality, when you say that the virus, this variant, is 60% more transmissible, we're so conditioned to do kind of like, that we think, 6 feet protects us, that 15 minutes is how long of contact that you need with somebody to be exposed to the virus. What does that actually mean in practical terms, that this virus is so much more transmissible? How easy is it to get it?
Well, and I haven't worked out but little napkin math I can do in my head here. It's really, if you're in a room of people and one person has COVID with the original strain, you're at a certain percent chance of contracting that. Maybe it's 5%, maybe it's 8%, something like that. If you're in a room with one person with this, you got to notch that up about 60%. So now maybe instead of 5%, maybe it is 8%, maybe it's over 10%. The problem is when you get multiple people in that room with this variant, now your numbers are 20% or so, and it just, you're just playing the odds, and you might get lucky the first time, the 5th time, the 10th time, but there will be a time that many people will be unlucky, and then they're going to get it. And just like with the original strain and every strain we've seen, that is going to affect everyone a bit differently. Some people are going to unnecessarily get really sick and die, unfortunately, and that's what we're trying to avoid.
All right, Dr. Rob Davidson, Michigan ER doctor and the executive director of the Committee to Protect Medicare. Really good to have you on this morning. Appreciate it.